My name's Michael Day, and I'm the Professor of Veterinary Pathology at the University of Bristol Veterinary School. And I guess in the context of the meeting today, I'm also chairman of the One Health Committee for the World Small Animal Veterinary Association. I guess what I tried to do in the lecture was to talk a little bit about the history of One Health, which is actually quite old, but reinvented and re-established in the last sort of decade. And of course, One Health is fundamentally about the interaction between human health and animal health and what we now call environmental health, so the triad of healths, as it were. And it really is a very simple message that it's much more cost-effective, much more scientifically robust for these different disciplines to work together to the ultimate end aim of controlling infectious disease, either in man or in animals, or indeed in the environment. Really, One Health, I think, is understood by the veterinary profession and perhaps less so by the human medical profession. And I think the reasons for that are the breadth of veterinary education. We basically do adopt a comparative approach. We look at multiple different species, and we're always taught about what's happening in human medicine and how what we are doing is comparing. We also have a very broad education in public health. And I think perhaps human medics who have to deal primarily with one species don't understand this breadth as much as we do. And again, we talked about how that could be remedied or rectified. And I think a lot of it goes back to the education and the fact that it's important, I think, to instill this One Health concept into the curricula of both veterinary and medical training at an early point, and to make sure the message gets heard. And how do we do it? It has to be education, I guess, and somehow we have to get into that community. And I think events like we've held today here at the RSM are perfect examples of how that can be achieved. I know we have first opinion general practitioners in the audience, and I hope that they've seen a completely different perspective today. And we need to do more of that. We need to get into that community to provide that education.